Okay, hello everybody, I'm back and welcome to the GAO askdrkim channel. And today I'm going to share a clinical case of decementation of link abutment that I experienced recently. Okay, so 4 or 5 years ago, patient came like this. This patient had many bad teeth and a lot of things to do. You can see the decays and resorptions and bad fillings. And patient have a lot to do, but his cheek complaint was number 22, which has periapical vision and broken. And also you can see the fracture line and decays, etc. Okay, so in the CT scan you can see the perforation on the apical part as well. So we decided to go for the immediate implant placement, and an implant was placed, cleaned, placed, and had a bone graft and covered with the membrane and sutured. So a few months later, and the patient came back for the uncovery of number 22 implant. So this is how it looked afterwards. Okay, so after that, few months later, I made a restoration like this. So I used the link abutment, zirconia core, and zirconia crown. And this is how it looked in patient mouth with abutment, with the crown. And the direction of the implant, the angulation was not bad, so I made a lingual hole covered with the composite. Okay, so this was done 2015 September, end of September. Okay, so after that, patient was under the periodic follow-up, and this is CT scan before and afterwards the implant placement. And this is actual CT cuts during the follow period of number 22 area. And suddenly 2019 January, like a few months ago, patient came back and he was presented with the rotation and movable crown of number 22. Okay, so from the radiograph you can see the gap between the link abutment and zirconia core. Okay, but thanks God, I have lingual access hole, so I remove the composite on the lingual side of number 22 implant's crown. Then I can remove abutment and the crown at the same time. Then this was not decemented completely. This is like a partially moving, so I removed from the link abutment and zirconia core, and I was planned to cement it in patient's mouth, okay, at the beginning. At the when I see the patient, but problem was this link abutment between link abutment and zirconia core has the gap. It's not stable enough to cement in patient's mouth. So I decided to make impression and made a model, and I cemented on the model. Okay, so this patient has to go back without number 22 at that day. The day when patient came for the number 22 was mobile. Okay, so I have to ask him to come another visit for delivery again, the number 22 implant supported link abutment zirconia crown case. So after that, when the patient came for the next visit, I delivered the restoration and I cemented on the model. Okay. So I've been using the link abutment for 5-6 years now so far, and this was first case that has a problem, complication. Okay, and I'm not using like a link abutment for every case. I have very limited indication. I'm using it for very limited indication. I'm very careful about the link abutment, and if patient came like again like this with the link abutment, I think I'll do the same thing. I'll make a model, and I'll cement it on the model and deliver it in the next visit. Okay, so I hope you enjoyed this presentation, short presentation. I'm thinking to come back soon. Okay, thank you very much for watching, and bye bye guys.